This is Microneedling 101 with Dr. Scott Martin. We're going to show you everything you need to microneedle, whether that's scalp restoration, face restoration, hand jobs, foot jobs. You only need a few items, okay? I start with a Dr. Pen 8. You can buy this on Amazon. I use lyophilized exosomes from Platinum Biologics. I only use Nano X. It's 30 billion exosomes with proteins and peptides. I buy a 1-ounce atomizer off of Amazon. You need preservative-free normal saline. I use a 20 cc syringe, and I use an 18-gauge fill needle. So to prep the site, I use witch hazel, and you can use topical anesthetic if you want. I typically use a 28-8-8. That's 28% bupivacaine, 8% lidocaine, 8% tetracaine. And I cleanse the entire area with witch hazel. You use witch hazel very simply because alcohol denatures your biologic. When I fill this syringe up with preservative-free normal saline, I bring this into solution. I am not sloshing it back and forth. I am gradually, with 3 cc's, bringing my exosomes into solution. I inject all 3 cc's into this 1-ounce atomizer. I add another 27 cc's of normal saline so that I have a 1-to-1 preparation, meaning that this is 1 billion exosomes per cc. I've already cleansed the site with witch hazel. Again, we're not using alcohol. I spritz the application site with exosomes until it's moist, okay? Once the area is moist, then I'm gonna microneedle. Now, I prefer to microneedle at 0.25 millimeters. It is not painful. You can do it without topical anesthetic. If you use topical anesthetic, you please wash that off with witch hazel. Now, if you are going to apply, and you're going to do this in a region that is the face, you can swirl, all right? And you can glide. This is what some people call it. However, if this is face, please be mindful. If it's face, you want to slide in certain areas. You may want to put more pressure in other areas. Most important is hair. Hair you want to stamp, what I call vamp stamping. You want to stamp so that you don't drag hair out of the scalp, all right? And you simply move in a measured direction all the way through the application site. Now you can see I haven't drawn any blood, all right? Now, this really is not painful. The focus of all microneedling should be on the area that's most concerning to the patient. If you're microneedling for hair loss, focus on the area first that their hair loss is most disconcerting to them. Widow's peak, part, crown. If it's the hands and what they're most concerned about is sunspots, concentrate on those first. If it's face and what they're concerned about is, little lines or little blemishes in their skin or areas where they really want tighter, more firm skin, concentrate in those areas first. But to review, Dr. Pen 8, 30 billion exosomes from Platinum Biologics, Nano X, 1-ounce atomizer that you can buy off Amazon, preservative-free normal saline, witch hazel, 20 cc syringe, 18-gauge needle, and the Dr. Pen 8 comes with very different heads. I prefer to use the 16 or the Nano for all of my applications. I'm Dr. Martin. Have a very blessed day.